first thing you want to do with the bird is inspect it. Make sure it's clear of ice, because it should be packed in ice. Make sure it doesn't have any weird blemishes. Okay? You should also be able to identify what is the front and the back of the bird. Okay? The breast is on the front. The breast is very kind of heart-shaped. Okay? An elongated heart shape. The wings are off to the side. If it's laying on its back, the wings will point up, in case you get confused. Also, along the back, there's this spine, also known as the backbone, which is also a clue. Okay? Thank God it's not recording me, because I'm a smart ass. The first thing we're going to do is remove the wishbone. The wishbone or the collarbone is right in here. I would have you touch it, but I want you to keep your fingers clean. A lot of people will go in there with their chef's knife and sort of rub it out and then expose it and cut it out. What I do is I feel for it, and then I go in with my knife just on the outside of each side of the wishbone. Okay? Then my fingers go in there and I can feel the bone, and my fingers are going up to where the bone meets, grasping the top, and there's a little bit of connective tissue underneath it. Oops, broke a bit, but that's okay. You want to make sure you get it out. That's the wishbone. Okay? Now, since we're doing 8-way, we're going to remove this excess skin. We're always going to keep that separate. Skin here, all bones there. Lay the chicken on its side and pull the wing straight out. Straighten the wing with your finger. Okay? And here in the armpit, we're going to make an incision. You should be able to go all the way down until you see the joint, which is right there. One little cut with the tip. You want to reserve as much breast as you can when you're doing this. You want to go right through the joint. You should see the exposed joint when you're done, when you're doing it this way. We'll set that aside. We'll do the same thing on the other side. Straighten the wing out. Make a cut into the bit. You can see where the breast and the wing meet. You want to cut on the side of the wing. Again, you want to reserve most for the breast. Okay? The next step is we're going to remove the leg quarter. We're calling it the quarter because it's going to include the drum and the thigh. Use your fingers to separate. You want to cut closer to the leg to open up this skin. And then I use my hand and I open it all the way down. And you can see here the pelvic bone runs there. I'm going to put my fingers on the pelvis, my thumb on the knee, and I'm going to pop that joint out. You can see the ball and socket joint has popped out. Then I'm going to take my knife and go along the pelvic bone. Until I get to the back. Once I'm on the back, I go along the pelvic bone until I've exposed the socket, the ball and socket joint. Then I'm going to make a cut perpendicular to the spine. The spine is running this way, so my cut is going to go that way. Just on the head side, head's missing, just on the head side of that socket. And then I'm going to pull the entire leg quarter towards the head. And what's going to happen is that muscle right there that was in that cavity is going to come out clean. And that's called the oyster. We'll keep that intact for now. We're going to do the same thing on the other side, just less talk. Hop. Horizontal. And what that's doing is it's cutting a little bit of connective tissue at the top of that oyster, and then pull towards the head, and the oyster comes out clean. Again. So the next step, we're going to lay head down, we're going to hold the tail up in the air. And you can see a line of fat there. It's on both sides. The chicken has instructions, basically. We're going to go through those thin membranes and out. Then we're going to go towards the back, and then break the spine. That comes off in one piece. We'll set it here, but I'm going to clean it and put skin here and bone there. Now I'm going to set this down so the head is up and the breast is away from me. I'm going to go down the spine on either side. Cut it through the jointed ribs. I'm going to go ahead and remove that skin. You can usually do it by hand without cutting. That's good for stock. Now I'm going to turn this over, and I'm going to have the point of the breast going towards my knife hand. Okay? You can see inside the cavity here, there's some connective tissue. See all that? Does it look like an X? Yeah, what does an X do? Correct. So you're going to put the knife down at a 45-degree angle on the cutting board, and you're going to draw it into the convergence of that X until you meet resistance. Now, not resistance, that's the keel bone. Once you meet resistance, you stop. Don't cut through the keel bone. You're going to pick it up, point away from you like a book, expose the keel bone on one side, put your thumb on it, expose it with the other. Lay it back down, run your finger along the keel bone, and your thumb. Where is it? There it is. I missed it. On each side. If you don't get inside the connective tissue, it's okay. You can always trim it back. Just using the tip of your knife. Pinch. There we go. You get inside of it. So there's the keel. All right. Then, where the keel was connected, you're going to go underneath as close to the ribs as you possibly can. Go out. Ribs. Ribs. Got good skin coverage, that's what we want. Trim off a little bit of the excess. There's the skin. Now, these are the tenderloins. This one, the protective sheath has been removed, and this one I'm going to score it very gently. Come on. There it is. And then if you hold it right there by that tendon, comes out in one neat piece. We'll leave those on the cutting board. See why in a moment. And now, on the breast, we have remaining this connective tissue in the middle. I'm going to cut to one side of that, all the way down and through. It's going to leave me one boneless, skin-on breast. And on the other side, I'm going to tuck the skin back a bit so I don't lose the skin. A little bit of bone there. And that connective tissue, where should that go? Stock. And this white sheath, you can actually pull right out. That's good stuff for stock. Check the other one. That's relatively clean. You don't have to do that, but might as well. So we have boneless breast. On the leg quarters, see that line of fat? You're about a ½ inch over. Goes right through the joint. ½ inch over. Right through the joint. So I'm taking the skin off because in poultry, all the fat, there's no intramuscular fat, that is fat in the muscle. The muscle is just lean, but there is fat in between the skin and the musculature of the skeleton. Oops. So all that is good for stock. Now, these tendons are not necessarily really edible. So what you want to do, it helps. The butcher has a good thumbnail on their non-dominant hand. I do not. Just put it down, and that tendon comes right out. If Your tendon's not completely exposed. Expose it. No. Cool. That's one. The other one we're going to show you, and always just check the cavity here. Do me a favor, go ahead and stop. Actually, I'm going to need to wash my hands. See, there's this stop.